Hi, today we'll be talking about the topic health issues. The scope will be health issues among Malaysians. So health issues such as heart disease, lung disease, HIV or AIDS, stroke and diabetes are the most common disease that is known among Malaysians. According to Statistics on Death in Malaysia, these health diseases are the main cause of death among Malaysians. Hi, so now we will be continuing on the heart disease. So what is heart disease? It's a symptom that basically shows that there's a malfunctioning in your heart that leads to any disease such as heart attack. So what are the factors that cause the heart disease? It's basically caused by smoking, high blood cholesterol, high blood pressure, physical inactivities, obesity, and diabetes. And the effects on human body for having heart disease is tightness on chest, short on breath, pain and numbness, injury, or even fatality. The methods that can be used to cure or prevent the heart disease is to exercise regularly, eat healthy, and taking care of mental health.
Next, I will explain about stroke. For your information, stroke is the number 5 cause of death and leading cause of disability. Furthermore, as everyone knows, stroke is a disease that affects the arteries leading to and within the brain. This deprives our brain tissue of essential nutrients and oxygen. Within minutes, the cells begin to die, impairing the activities of our brain. Strokes are potentially fatal, but they can also be prevented because many stroke risk factors are tied to one's lifestyles. Anyone may reduce their chance of having a stroke. Moreover, do you know that stroke have two risk of factor, which is a preventable factor and unpreventable factor. As you can see, preventable factor include obesity, high blood pressure, excess smoking, diabetes, cholesterol, and alcohol. So, why this list of factors are preventable is because we can take an action to avoid before we get involved with the disease. While for unpreventable factor, it is include gender, age, menopause in women, and so on. This risk of factor, I recommend to seek a doctor that will assess our stroke and help you to control the problem before it becomes serious. Besides that, I will continue my explanation with effect of stroke. There are several effects of stroke, which is physical changes, communication, memory and cognitive ability, emotion and personality. This effect is a common long-term side effect of stroke. So, to prevent the long-term side effect such as memory loss, paralysis, difficult speaking, anxiety, and so on, we need to be fast as a formula to recognize the symptom of stroke before it become worse, which is B for balance. The person will start to feel dizzy and lost balance. E for eyes, which is the person will have blurred vision. F for face, the person will feel one side of the face is drooping. A for arms or leg, which is one side of the body feel weak. S for speech, difficult to speak. Lastly, T for terrible, which is terrible headache, which the person feels sudden headache with no reason. Last but not least, I will talk about the treatment and rehabilitation option after a stroke. There have 3 categories to prevent the disease, which is medication, rehabilitation therapies, and lifestyle changes. For medication, patient can use anticoagulants to slow down the blood clotting, antiplatelets to prevent blood clotting, and other medication for related health conditions such as hypertension, diabetes, and cholesterol. While for lifestyle changes, the person can do exercise 30 minutes per day, which is 5 days per week, or as recommended by the doctor. And also the person can take nutrition, which is a healthy nutritious diet that provides sufficient calories, creates a healthy lifestyle habit such as quitting smoking and limiting alcohol. Okay, that's all for me. Thank you.
HIV/AIDS disease. No cure for HIV. What is HIV and AIDS? HIV is a short form of human HIV/AIDS disease. What is HIV and AIDS? HIV is a short form of human immunodeficiency virus. It is the virus that damages the cell in your immune system and weakens your ability to fight every infection and disease. While AIDS is acquired immune deficiency syndrome is the name used to describe a number of potentially life-threatening infection and illness that happen when your immune system has been severely damaged by the virus. About the HIV. First, the factor of HIV. Second, consequences of HIV. Third is the prevention from HIV. First, the factor of HIV. It may come from drugs, sex, and transfusion. For the drugs, contaminated equipment carried HIV, while sex, having vaginal or anal sex without protection. Third, transfusion. Blood transfusion or tissue transplantation transmit the virus to others. This is a statistic cases in Malaysia in 2019, which is annual report cases in Malaysia from 1986 to 2019, which is the trend is decreasing by years. HIV infection by risk factor in 2013. As we can see, the heterosexual transmission is the highest percentage, followed by injecting drug use, 22%, homo or bisexual transmission, 21%, unknown, 3%, and the list is mother to child, which is breastfeeding or nutrient from pregnancy mother to the fetus. Next, consequences of HIV. First, fever, cough, swollen lymph nodes. It was an initial symptom of HIV. Next, tuberculosis, which is TB, is the leading killer of people live with HIV. Third, Kaposis sarcoma, which is the main cancer to affect people with HIV. Last is AIDS, the final stage of HIV if do not getting any treatments. Next, prevention method. First, do a HIV test at any clinic or hospital. Second, practicing a safe sex. Third, do not share drug equipment and ensure it was sterile. Last, do a screening before marriage and pregnancy. Together, we stop HIV spreading. It was this in my references, and that's all from me. Thank you.
Hello, today I'm going to present about lung disease. When you breathe, your lung absorbs oxygen from the atmosphere and send it to all your plasma. Your body cell produce oxygen to function and flourish. You breathe almost 25,000 times every day. On average, people suffering from lung illness have trouble breathing. Lung illness affect millions of individuals in the United States. When all forms of lung illness are included, it is the third leading cause of death in the United States. Lung disease refer to many disorders affecting the lungs such as asthma, infection, and lung cancer. Next is a factor. Factor of lung disease. It is a tobacco consumption, air pollution, occupational accident, and allergens. Next is consequence of lung disease. First is the airway disease are one of the lung disease. This disorder damage the tubes, which is airways that transport oxygen and other gases into and out of the lungs. They frequently includes constriction or obstruction of the airways, asthma, chronic obstructive pulmonary disease, which is COPD, and bronchitis are all airway illness. People with airway illness frequently describe themselves as trying to breathe out through a straw. Next is lung tissue disease. Is one of the lung disease. This disorder have an effect on the structure of the lung tissue. Scarring or inflammation of the tissue prevent the lung from expanding. A completely restrictive lung disease. This makes it difficult for the lung to take in oxygen and expel carbon dioxide. Okay. Next is prevention. How to prevent from get the lung disease is avoid smoking. Second is inhale a medication. Next is exercise regularly. And the last one is a spirometry test. That's all from me. Thank you.
Okay, next I will talk about diabetes. What is diabetes? Diabetes is a group of disease that affects your body use of blood sugar, or in what we call is glucose. Glucose is essential to your health because it provides energy to the cells that comprise your muscles and tissues. It's also the primary source of fuel for your brain. Diabetes is caused by a variety of factors. However, regardless of the types of diabetes you have, it can result in excess of sugar in your blood. Too much sugar in your bloodstream can cause serious health issue. Okay, here is the risk factor for diabetes. The family history, high blood pressure, weight, inactivity, age, and abnormal cholesterol level. The family history can relate from our parents or our siblings. For the high blood pressure, we need to monitor more the level so it may not expand to the high level that can cause the high blood pressure. And the weight we can say stay healthy and don't eat unhealthy food, or we call junk food, like that. For inactivity, it's like the no exercise lifestyle, no diet plan or and so on. For the age, we can related like the young become an adult, and for we can old. It can affect from the adult or the teenager age until the old age. Okay, for the abnormal cholesterol level, it affects from the less monitoring in our eating, like the junk food or the food that we eat, so many from the calories that we used to have. Okay, the consequences from the diabetes is blurred vision, slow healing shows, fatigue, skin problems, unexplained weight loss, and frequent urination. Okay, to prevent the disease, we can eat healthy foods, do physical activity, and we must avoid from tobacco. these three can help us from diabetes. Like the healthy foods, like eat the vegetables and enough carbohydrate and enough protein, and less eating the junk food. The second one, do the physical activity, is like jog or doing any sports in the evening, and never avoid from our diet plan. Okay, the third one, avoid from the tobacco. Here, the tobacco can affect dangerously to our body and our health. Okay, and that's for all for me. Thank you.
So fortunately, the awareness of health among the Malaysians are really high. So most of the statistics that we got, Malaysians mostly agree on the factors that cause the health disease, the effect that's caused by the the health disease, and the methods to solve the health disease.